Hello, Dr. Prem. Nice to see you. Thank you for having time to discuss this global agenda, which is happening at the moment. And how do you feel what we're having these days, this pandemic and this maybe just economic shift, just maybe even paradigm shift in the health travel in global business?
Yeah, first, thank you very much for inviting me. It is always pleasure to communicate with you, connect with you. And I know you are putting great efforts in Lithuania and in fact, entire region to raise awareness. And thank you for inviting me and thank you for having me. Yes, we have seen this pandemic hitting very badly. Many industries have suffered, and I guess mainly tourism and travel industry have suffered a lot. Rest other economies have recovered quite well. They still have to do a lot, but specifically travel and tourism industries in a great difficulties, I must say that. But we must learn from everything, and somehow I feel that the world managed to handle this crisis, which means that we have a less mortality rate as compared to what they were thinking, that if the pandemic will come or endemic will come, how they will affect the entire global. So in that sense, we managed the lockdown help and some other activity help. So in that sense, some of the initiative which governments have taken proactively, be it in Asia or in Europe, those have helped and people have understood. And now people have realized that this COVID is part of life and they are not going to, and is going to be here with us for a long while. And people have already accepted it and they have started going out with wearing mask and other precautions. So we have accepted. Let me put it in this way.
Okay, and we have the first wave, if we can call it so, last winter, last spring, and we have a little break until now, while numbers are rising rapidly. But we have a little break, and we had time to prepare. The world had time to prepare for second wave because most scientists were telling that it will be coming,
more dangerous,
and probably it would be stronger than the first, and now we can see that. So how do you see if the world has prepared for the second wave, and health businesses and healthcare sector, did it make some really significant steps for preparation? Do you see that?
I wouldn't say that we have done significant steps to be prepared, very honestly. I wouldn't say that we did anything different than what we were doing. What we definitely learn about how this pandemic affecting, and we definitely learn about the challenges and difficulties and what are the precautions we need to do. But in terms of complete preparedness, no, I wouldn't say that world has completely understood what they need to be prepared. And also, we also have seen that different geographies, different region has different methods. Some gone for the full lockdown, some gone for the partial lockdown. So there is no one uniform philosophy or activities done across the world to deal with this pandemic, and every country is dealing based on their own activity. Some countries are open to travel. For example, Turkey still has a lots of flights. Dubai has so many flights and tourism open, and some countries are completely closed, right? So there is no uniform activity happening as such across the globe. We understood what it is, and we understood that it is difficult to deal with it, but we are not completely ready for second wave. So when the second wave will come, I guess based on the mortality rate, the severity, the impact of it, each and every country will take a separate measurement, separate decision based on the second wave. I have heard that in Europe, second wave has already started in some part of Europe, and it hasn't reached to all part. And in fact, definitely not here in Asia, the second wave. But as the winter will go strong, as winter will approach more, I am very sure the second wave is going to be strong because we don't have a vaccination or therapeutic treatment in near sight at this moment.
And as I know you are traveling much, at least used to when it was open. So you were based in Europe, as I know, for a long time, and at the moment you are in the Mumbai, in India.
Yes.
Can you compare these two different, pretty different worlds, Europe and Asia, India? How governments are reacting and how people are reacting to the pandemic, and how can we learn from that?
Well, to be honestly, Germany has set up a great example. New Zealand has set up a great example about how to deal with this pandemic. Unfortunately, number of cases are very high in India, but I wouldn't say that if you compare the per capita basis, the kind of population that we have, and the mortality rate in India is very low. I mean, the severity of disease is not that in compared to what happened in Spain and Italy and all. When the cases were hit, the mortality was very high. So I guess that even it is same virus, but it has a different impact in different region. Probably one of the reason why in India mortality rate is low is also because we get the vaccination for SCG, and that vaccination has probably proven to be beneficial to deal and fight with particular cases, and not all cases are becoming very severe here. But I guess I would leave it to the expert of this particular disease to deal with this matter, and I will leave it to them about how they are looking at and evaluating the conditions and situation. All I say from medical tourism and wellness tourism perspective, that not each country is handling this particular situation in a same way, and some countries will initiate the medical tourism and wellness tourism far before than the other countries, and that will bring a great shift of the market. Right, previously the medical tourism market was mainly based in Eastern Europe and some part of Asia and South America. And now I don't see Europe to go and start medical tourism suddenly, right? And it will take time for them. And also we see here in Mumbai, the flights are completely closed. The international flights are not even open up right now. So the patient flow is completely stopped over here as well. And very few destinations like Thailand and Malaysia have started initiating some sort of medical tourism, but many countries are completely closed for tourists. I heard Japan is closed for tourists till month of April 2021.
Don't you think some specific procedures should be made for medical tourism, health tourism, to make it easier to start again? Don't you think government should come up with some suggestions, or private businesses should come up with some suggestions for governments to allow to transport medical tourists with some specific precautions, some specific procedures, just to engage again these activities?
Absolutely, and completely agree. We need to understand a medical tourism industry is based on certain needs and demands which you cannot avoid it. For example, for African, they don't have any resources in their home country to get the treatment. So they do need to travel for oncology treatment, for orthopedic treatment, for any kind of severe complex disorders. So all the 50, 60 countries, and talk about our neighboring Asian countries, they don't have that quality healthcare system. So they would need to travel. Not allowing them to travel would only increase the healthcare burden on that population, healthcare diseases. So medical tourism is not recreation tourism in general. It is not a tourism which you just do it for the fun. You do it for purpose. And that need to be restarted. And also patients who are not able to afford a medical treatment in US, they definitely are looking for the affordable solution. So there is no solution for them, and they want to travel back to South America, and within the Europe also, they want to travel. So medical tourism should start, number one. While it should start, SOP should be in place. Certain operational procedures and guidelines and ideas about how they are going to reactivate, from which countries they are going to reactivate, particularly the destination who have a low COVID rates, they can be open up. And now you can do the COVID test on airport on arrival. So you can do the test on arrival. And if you find that the person is COVID positive, you can just simply quarantine that person in facility for next few days until a negative report comes. So these are the possible situation we have. And uh, stopping medical tourism completely is not a solution, neither for the industry nor for the government, and definitely not for the patient. And they do need to start, and they do need to set up certain protocols. And I completely agree. There is no association, there is no organization, there is no particular council working together to come up with some sort of SOPs. There is nothing happening on that. And that's a major flaw in this industry, to be honest.
How do you think what body should be involved in this scenario? In this case, should it be a World Health Organization, or should it be local authorities, or should it be World Tourism Organization, or what type of body it should be just to start these talks between each other and then writing these procedures?
So we know that World Tourism Organization has been trying to create some structure for medical tourism from long time. They had a couple of meetings, they had a couple of discussion, but there hasn't come any particular protocol driven association which sets up protocols or guidelines or strategies. So we haven't seen anything happening. But I'm also talking about the regional association. We have many global association in medical tourism and regional association. I won't name them, but they also need to come together, or at least some regional government driven association. So if country, my country, other country, medical tourism association can come together, and they can have some sort of clear strategy, and then they can propose to the tourism board, immigration board, about the visa guidelines and all that. Listen, we need to restart medical tourism. So these are the guidelines which private healthcare industry is ready to follow, right? Which definitely should involve the private healthcare associations and councils of private healthcare association. And this is how we need to restart it. But unfortunately, nothing such happening. And at this moment, only few countries are allowing medical tourism. And it is not even 20% of what we have seen, the medical tourism activities.
Okay, and how do you think maybe businesses themselves could somehow come up with new ideas, maybe new concepts of providing health services, allowing people to have treatments while most of big clinics are fully booked by COVID patients, or just find some another innovative cases, innovative ways to come up with proposals, consultations for medical patients while they cannot travel. Do you see any innovative ideas how clinics and medical tourism facilitators can act at the moment?
Yeah, I mean, one of the great idea I liked about Cyprus government and Turkey also in that regard. Cyprus said that if you're coming to visit our country, and if you were COVID negative when you decided to come, and if you found COVID positive when you come to our country, the country will take care of your medical expenses if there are no severe complication and all. So which is a great initiative. And now Turkey has complication insurance for medical tourists also launched recently, that if you are as a patient, if you are giving sufficient documents, sufficient information to the hospital, and hospital is giving you a quote about the treatment, in case any complication comes in, the insurance company, that insurance will be bearing those expenses. So these are the innovative ideas which are happening. And I'm also very supportive to this particular idea, which I'm anyway talking with some of the hospital who are my client. I'm telling them that invite patient, if they are, government is allowing you to invite them. If they are COVID negative, invite them for visa and all, just in case when they come to your country and they found COVID positive, just give them quarantine facility to them. It won't cost you much, number one. And also, 85% to 90% of these patients do not require any severe treatment. They are just either asymptomatic or minor symptoms, and with simple supplements and simple medications, they can recover. So the cost of expenses for home quarantine are not huge. So I have been proposing this to my hospitals, not only in India, but abroad also, that when you pitch to the patient, you can probably propose them a COVID quarantine facility, and you can afford to give them for 14 days quarantine facility. But I completely agree that hospital need to understand that these are challenging time even for the patients, challenging time for everyone. So they need to come up with some structure, some plan, some packages which keeps the COVID in factor in mind. And they also need to create flexible approach, and flexible approach in the sense that, okay, patient book the appointment on, let's say, first week of December, he's planning to come, but all of a sudden flight got cancelled, all of a sudden visa got cancelled, all of a sudden country got closed down, so that everything should be possible for patient to move appointment without any deduction in fees or without any additional fees or charges to them. And these things are very important from patient's perspective.
And how do you see the options for transportation? Because as we know, flights are cancelled. Many companies are standing by for pandemic to come down. Any possibilities just to make it possible while planes are grounded?
Yeah, so there are two possibilities here. One is obviously if there are countries like Eastern Europe and Europe, they are connected by road very well. So patient can travel for non-emergency procedures and the procedures which are not require immediate medical attention, number one. Number two, in terms of there are still helicopter services, medical evacuation services are active and they are working. And for example, just to give you an example, there was a one cancer patient I had from Ukraine, and I had to speak with a hospital in Israel because patient particular wanted treatment in Israel. And they said that at this moment, they are accepting patients who are critical condition, who they require immediate treatment. Otherwise, they are not accepting, which I loved it because I liked it that the particular idea about that case, that they are happy to bring the patient which are critical condition. And they said that they will be able to do some arrangement for them or propose flights or some arrangement for them, which was very good. And they are even open for getting emergency helicopter. And I spoke with one of the helicopter company, and they said also they are absolutely open at this moment as long as the patient has a visa, and also they're ready to do all formalities for transporting patient. Trains and other things are only possible in the countries like Europe, which are connected very well, but it's not possible in many parts of Asia, or Africans really can't travel without flight to India or any other destination.
Okay, but if we would look for options to cooperate between businesses and to maybe even to bring doctors closer to patient if patient cannot come to destination country. So how do you see the option like creating teams of medical personnel which could travel to destination countries and provide services there?
I don't know how many years back when I was in Lithuania. In fact, I remember that when I had a workshop in Lithuania, I specifically put this point that future of medical tourism is not about patient traveling from one destination to another destination. It is also when the doctors and teams of doctors and hospitals shifting from one destination to other destination. Because when you talk about patient, you're talking about 50, 100 patient traveling to other destination, which is logistic nightmare also. But if somehow we can create an industry, a truly globalization of healthcare will only be possible when the supplier provider goes into those destination market and provide the services also. This hasn't happened yet, but we do see that this medical tourism has opened up a dynamism a lot. So dynamism of telemedicines, teleradiology, teleoperation, and coordinated operation between the doctors, while the general surgeon would be doing the surgery, and then the remotely monitoredly by any other cardiologist or any super specialty doctor under his observation. So I'm very much aware about the new technology coming after the robotic surgical equipments, that this kind of technology is already in the pipeline, where doctor can remotely operate under the observation of the local doctor team there, which is very much possible. So this is the time to initiate that, number one, and also time to initiate that the expert medical should travel abroad now if they cannot get the patients from Africa, if we can't get the patients to India, and from, let's say, in Middle East, we can't get the patient to Europe. So some of the team of Europe can travel to Middle Eastern countries and go there, operate patient, and provide them treatment. That is more viable solution at this moment.
Okay, and without traveling, do you see any other options? While, as you said, these super high-tech technologies are only in pipeline. So at the moment, are there any options to come up with some innovative ways to maintain connections with patients remotely, like remote consultations, just providing basic information what patient can do for himself sitting at home, maybe some physical activities, maybe some, seminars, how to do yoga, how to maintain his health by himself, having a healthy living, good food, and so on. And just by this way, to maintain connection with patients.
Definitely a part of medical tourism. We are looking for a very big wellness tourism industry, and wellness is going to be the future. Everyone has understand the value of well-being right now. Everyone has understand the value of maintaining themselves, and this pandemic has brought the age-old philosophy back into the situation where everyone understood that the importance of taking care of themselves through whatever means you want to do it, whatever ways you want to do it, but you have to take care of yourself. And we predict that wellness tourism will get a major boost from this. And we also predict that the wellness therapies would be provided remotely. So the expert from, let's say, yoga expert from India, Tai Chi experts from China, or some other expert from some other European destination would be able to create association with different wellness resorts, where the local wellness population will be getting the benefit from this. And tele-wellness solutions are on great growth. Not only telehealth and telemedical solution, telehealth and telemedical medicine already happening. Telemedicine has seen a significant boost, and we know that many telemedicine providers jump in suddenly and started getting, and many hospitals are ready, remotely operating, providing treatment, which is a great development, so that now patients are able to get the consultation of the doctor sitting at their home, which is a great thing. So we must be thankful to pandemic to initiate this, but we will also see tele-wellness, which is more about, wellness therapy specialist can't literally travel all the places, because usually wellness therapy is a longer, sometimes you need 15 days, 30 days, and patient cannot stay 50 to 30 days in a resort. But now we are talking about annual packages. So all wellness resorts started thinking about creating some sort of annual packages which allow guests or visitors to come for 7 days, 15 days and stay in resort, but rest of the time is also equally important for those patients. So rest of the time they can remain connected with the therapy provider or wellness provider through tele-wellness applications.
Recently, I was talking to my colleague from Wellness Center, and my colleague was saying that you cannot remotely make a massage, you cannot remotely put people into the bath, into the mineral water, have them smell therapy or something else. So what would you answer?
Oh yeah, I mean, now you have these pearl shell bathtubs you have with new equipments are available, and a small centers are having this remote small clinics which is this pearl shell bathtubs where we can control the temperature, you can control the amount of light you want to give it to them. And for example, if I'm a wellness therapist and I want to treat someone based in Mexico or in Costa Rica, right? Then I could probably give a franchise to them and use this equipment. Agree that massage are personal treatment, but other than personal treatment, there are treatment which are driven by equipment. Or maybe I can guide a massage therapy provider about what to do, what not to do. So certain protocol, if I tell them how to do it, I see the future is opening up. Future is opening up with these ideas about integration of various therapy providers between this center and that center, and they connect together and providing the therapies, which I see the ideas are getting opened up.
Do you see that this pandemic is probably a paradigm shift in most areas in economics? Like electronic shops is getting more and more popular. So in the health sector, maybe it is also can make a sudden paradigm shift, like to move forward innovations in different types of healthcare sector, not only in robotics, in surgeries, but also in the wellness sector, in healthy living promotion.
Absolutely. I mean, who knew that Google will ask all their team members to work from home, and work from home was debated from so long time that where the people were, if you remember from last 3-4 years, this debate has been going on, that the employees want more time to spend with the family because their transport times takes 1 hour, 2 hours sometime to reach to office, and literally hampering their health. And now work from home has become so part of our life. And now even my office, I'm just open probably twice a week, and rest of the time entire my team member are working from home. And this has brought a huge shift, and this has brought us the possibilities. And now all these big corporates realize that yes, this is very much possible. We were unnecessarily investing way too much money in the rental offices and way too much big spaces and all, and now they can have an office for the coordinations and for the meetings, and different team members can work. So that is a major eye opener for us. And I think so this pandemic has done lots of wonders as well, apart of doing the lots of negative damages and economic damage and all, but also done lots of wonder. One of the wonder which I personally love is the impact this pandemic had on the nature, mother nature. We saw so many videos that because of the low carbon, low transportation, the green nature flourished, and mother nature really enjoyed this vacation, much deserving vacation. So we realized that all this is possible. We can reduce the carbon footprint. We can reduce the transportation of employees. We can work from home. We can work with basics of life. We realized during this pandemic that we don't necessarily need all those massive things, and we can actually live a decent life without all the flashy things if we need to live it. So this has brought a great things in our life, and I'm really glad to learn all these things in my life, in my employees' life, my team members' life, in all fact of life.
I agree fully with you. There's a certain problem in this situation you described, because people have to stay so much time at home, and staying at home makes some people discomforted. How do you think, how could people manage this problem of staying at home too much, which they now used to, but they cannot meet people, cannot talk eye to eye? It's hard psychologically for people to be like locked at their places. How people could resolve this lockdown issue?
So just to give you an example, what we did is in our office here in my Mumbai office, we decided to meet probably just twice a week, and we decided to meet not for that entire stretch of 8 hours, even 5 hours, 6 hours of office, so easy transport and all. And that we realized that meeting twice a week solves lots of problem of that communication, coordination, and also it's a nice outing for people who they are not able to do. And when they come in the office, then we make their calls and meetings and all those meetings where usually they need to coordinate with someone else, like this podcast, right? So I am coming just twice a week to office, and every time when there is a conference or podcast like this, I do it from office because there is no disturbance. But rest of the time I'm doing from home. And we have realized, now come back to the first more point also, that people were already lonely and now they are even becoming lonelier, right? With the less social activities and lockdowns. Lockdown has pushed huge problem of loneliness and mental disorders. There is an interesting research, very, very good research. They say that loneliness is as dangerous as smoking 15 cigarettes a day. So if someone is smoking 15 cigarettes and the harmful effect he has, loneliness has the same harmful effect on the body and mental wellness. Can you imagine that? And loneliness is going to be one of the biggest disease, a part of these cancer, cardiology, and all those diseases, because loneliness also create more problem for people who have dementia. So 50 to 60% chances are more with those patients who to build a dementia with loneliness. So there are so many exciting figures which says that loneliness will push mental disorder more, and we have millions of people worlds, we are hitting into dollars, trillions of dollars on the maintaining wellness condition, which we will not be able to maintain it. And these loneliness could only be cured by social life, right? And having a frequent visit to the social outing and all. So definitely it's a very big challenge from both perspective, being lonely or being in the family all the time with the kids, and then you're not able to be productive sometimes. But I guess down the line, we will get ready, maybe 2 years, 3 years from now, we will get ready for both the things. We would get ready, and we need to get ready. The social system, the healthcare organization needs to do something about people staying alone. They need to have social worker visiting them, volunteers visiting them regularly, and having a social interaction with them. And there needs to be some solution for lonely people who are staying, especially the old age people who are staying alone. There needs to be some solution voluntarily done by society for them. And these approaches are very important, very important. And complete lockdown, I'm never in a favor of complete lockdown unless the situation is very drastic. Situation is so dangerous that you have no other choice than doing complete lockdown. I think so. Control lockdown is much more better than complete lockdown. A control lockdown, which means you still allow the certain people to go on certain days, certain activities, certain sector to open on certain days. So maybe banking you open on 2-3 days. Then other industry you open, oil and other industry you open on other 2-3 days, so that in that sense that your communication continues, your work continues, and you're reducing the number of staff coming to office, and you're not completely stopping. So we are open here twice a week in our office, and still, by the way, Mumbai hasn't lifted the lockdown yet. We are still under lockdown from month of March. It's still lockdown.
And how do you think maybe healthcare professionals and the healthcare travel sector, even companies which are now are facing lockdowns in some countries, could involve in this activities to make some steps to help people psychologically? Are there any ways to help people remotely to fight with this loneliness?
No, definitely. First, the health tourism facilitator or health travel agency need to come up with some innovative ideas to survive their own business also. But I think so more than health tourism, maybe the wellness tourism industry can come up with some idea. Here is some idea which I thought to share with the world is that the wellness resorts can come up with some sort of packages, especially for the lonely population. What they could do probably is that they can give annual packages to these lonely people to come and stay to these resort in a year, maybe 2-3 days every month, or 2-3 days or few days every quarter. They come and stay in the resort, and they can develop the community of all those people, and then within that community they can interact, communicate, meet with each other, and they can initiate some sort of activity. So the future of this wellness resorts, wellness clinic, and wellness therapy would be in long-term treatment. You can't think about someone taking vacation for just 3 days and 7 days enough. With the kind of mental diseases we are having now, the 3 days, 7 days are not going to work, and you will not be ever with the current stresses which we have and the difficult situation we have. You can never be, you say that you will live a well-being life with just taking 7 days meditation treatment or meditation therapy, 7 days massage therapy, 7 days Ayurveda therapy. No, it has to be in a regular practice. It has to be a regular, it has to be in a daily practice. If not daily, at least a weekly practice. So even if you are practicing meditation, you have to go a few days in a week. So now the packages need to be converted into the annual packages, wherein wellness resort, and by this way also, Europe has traditionally suffered with one seasonal problem. And I know that Croatia is such a beautiful country, and Lithuania also, during off season, many resorts are completely closed, completely out of business. And Europe has never been able to come up with any solution to overcome with this, which is such a because in many countries still the tourism works, business works only 5 to 6 months in a year. 6 months they are closed down. But now is the time to create some annual packages and invite these people during the off season or during the time when there is anyway no guest, and enjoying the facility at a very reasonable rates, very reasonable prices, and offering them annual packages. And annual packages might not be costly, because in any case, when you travel during the season, you spend 2 to 3 times more money, because hotels are costly, restaurants are costly, everything, flights are costly. So during summer holidays you spend actually more money, right? Because everything is costly during that time. But if you be a little bit wise, and if the wellness resort come up with some better packages, they can divide that 1 week expenses into entire year for a month expenses, or at least 2-3 weeks expenses. So I believe the focus has to be in annual planning in wellness side. You got my point, what I'm trying to say?
Yes, for sure. And now, finalizing our discussion, could you come up with some predictions? What's going to happen next?
I will be very honest that I don't think that everything is going to change suddenly from the early next year. Still, we are far away from the treatment. We are still far away from any therapeutic treatment or vaccination. And winter is going to be stretched. And until the spring hit, until the warm weather hits, I don't think that people will be really ready to jump in a lot, especially in the European countries or USA, Canada, and all these places. Maybe the tropical country, maybe the African, maybe the warm countries might start little earlier. But Europe, I don't think so. They can get ready to start lots of tourism in early next year. They will have to have some, probably they will have to forget about the first quarter next year also. And even though after remaining 6 to 9 months, we should be ready for business which is not at the same level of 2019 business, because still people were out of job, out of money. There was a huge impact of massive shortage of money in last 9-10 months with everyone, right? Everyone I would say that everyone is just survival mode right now, and they are spending from either their saving or salary cuts or reduced amount, whatever we can talk about. So they will not have suddenly a huge amount of money to travel. Of course, affluent society will be able to travel. There is no doubt about it. Affluent society was never in a problem, but that is just 10 to 15% of total population of the world. You can't say that everyone will be able to. So I think so somehow. Next year our business would be still less than 2019 in total, and I would only see the actual recovery happening in 2022, not 2021. 2021 would still be below 2019. It will be definitely better than 2020 in any case. It would be definitely better, but it cannot be same like 2019, because first few months will go without business again.
Mm-hmm. And the last question, as you are an Indian representative, maybe you could suggest some Indian options to deal with coronavirus. For example, when I was traveling in India some time ago, I discovered a sudden medicine, Indian native medicine, Shilajit. I was amazed, like how it pumps the immunity to fight with just different types of diseases. Maybe you can suggest native Indian Ayurvedic or some medicine to boost the immunity and to stay healthy.
Yeah, absolutely. I mean, two drugs comes on top of my mind. One is called ashwagandha. The meaning of this, the one which smell like a horse, medicine, ashwagandha is the drug, and the other drug is called guduchi, which is called pilloy in your language. These two are such great result oriented medicine, and also a part of that, drinking warm water, and you can put some simple clove, cumin, and some other herbs which you use, turmeric and saffron and other which generally warm up your body, which we call it. And we have Ministry of Ayush, which is for the Ayurveda, Unani, yoga, and Siddha and homeopathic medicines, and they suggest that these herbs, when you put it in the simple tea and simple your warm water drink, it actually helps a lot. But there are a lot many great Ayurvedic medicine which are actually working very well, and honestly it has a great result. I'm not giving any particular brand name, but I'm just telling you the Shilajit, for example. The literal mean of the Shilajit, I don't know if you know or not. Shila means mountain, the stone, and
mountain stone, yes.
Yes, and Jeet means the sweat of the stone. So actually the Shilajit is found in the mountain when the mountain starts sweating, so that the minerals comes out, and you just go and that pluck that mineral and you make medicine from it. So it's a pure herbal medicine. So it's a simple, the sweat of a mountain, and it comes out as mineral products of that. And similarly, ashwagandha, pilloy, and turmeric has really beautiful benefit in India. And in general, simple spices, just spicing up your food can also open up your nasal cavity. Just try to have a herbal spices. When I say that, more herbs, if you just put more herbs in your food and some spices and food sometime, and also constantly drinking warm water, we call it kada. Kada is a combination of warm water plus these drugs, which is cloves and cardamom, and you put cumin and you put some turmeric in that, or ginger in that, and then you just drink it simply. It's really helpful with this current COVID situation as a great precautionary medicine.
Thank you very much, Dr. Prem. Thank you very much for sharing your insights. It was very pleasant to see and hear you today. So please stay safe, be healthy, and I hope we'll meet sometime very soon.
Oh, it's always pleasure to be online with you or personally with you. Really have a great respect for the work which you and your other team members have put to, create awareness of medical tourism and wellness tourism in your region. So thank you for having me. Thank you for bringing this important subject. And I look forward for more such association, personal or online, to discuss more important topics.
Thank you again, and namaste.
Lovely.